So today's March 22nd, 2020. It was a Sunday. So I normally, I follow this statistics website that the world collaborates together on as far as reporting the numbers for COVID-19. And it's called Worldometers. And so basically every day at 7 p.m. Central Standard Time, which is where I live, they all report their numbers, aside from China, because they report like the day after. But basically I'm a numbers person, so I do this at 7 p.m. I always check the numbers every day and take a screenshot. So today, so far, there was 31,000 more cases today, and then there was about 1,600 deaths today that we know of that were obviously tested and that the case was closed due to death. As far as the United States, in the United States alone, we have a total of around 33,346 positive tested cases. Over 9,000 of those were reported today. And then the death count today was 112. I believe this was our first day above 100. And then, so that makes our total death count right now 414, at least as of where the numbers were at 7 p.m. Central Standard Time today. So I know that this number is large. I know that it's growing every day. Like I said yesterday, kind of exponentially. So we will see a rise in that. Part of that is just due to having the tests. They said on stage with Dr. Fauci and a couple other people that we should expect this over the next couple days, maybe like the next 4 days, just because as testing is becoming available, obviously the numbers are going to grow because we have tests in order to see if people are positive or negative for COVID-19. Once again, the numbers are just hard to take in. It's growing every day, and it's really sad to see. But so I'm going to report the statistics daily, just in the beginning, because that's like a huge part of this for me as far as everything goes. And then so Trump and his VP Mike, and then some of their COVID task force people spoke tonight, just kind of updating us on, I guess, Washington, New York, and California all requested their states to be marked as a national, I can't remember the name, but some type of disaster to where they could activate the National Guard. And so Trump has approved all of those. And so the National Guard is it's already activated in those states. And they're going to get extra assistance, including, everything. So masks, gloves, ventilators, they're getting, so much help. It sounded like they mentioned, like beds, like they would get, like, I think New York was going to get 1,000 beds. California was going to get 2,000 beds, and then Washington, I believe, is going to be 1,000 beds. So it's going to be like a lot of support. I know, and then also the Navy ships, the two medical Navy ships that we have. I guess Mercy is the name of one of them. It's going to the West Coast. They were going to go up to Washington, I believe, but they've changed their mind and they're gonna go to LA, actually. So Los Angeles is gonna be where the ship is supposed to dock at, just to help with anything that obviously we need help with. Which leads me to my next thing. So I've had my fair share about worrying what the job is of the National Guard, to be exact. And so today they kind of broke it down for us. I guess there started to be rumors that the National Guard was just going to try to enforce things on us and step into our lives and just be very controlling and like kind of in a scary way. So they wanted to make sure and clear the air on that today across all government, state and federal. So just to remind ourselves, National Guard people, they're the people we work with day in and day out. They're our neighbors. They're the kids that, their kids, like, know your kids, go to school with your kids. So they're people that we know, and the main purpose of their job is to help. So ideally, they are going to be helping assist with the medical stations, especially now that they've been activated in Washington, New York, and California. They're also going to be helping with supplies and just basically anything that they need. And Trump also made clear today that the governor of that state will be responsible as far as giving directives to the National Guard. So the National Guard in your state will be under direct orders of the governor. As far as the way Trump worded it today, that's how I understood it. So another thing that happened today, which, made me happy, was Governor Stitt. He also gave a news conference just basically right after Trump spoke as well. So I guess he's been working on getting 4 mobile stations set up for testing, which he didn't specify tonight where they would be. I'm assuming it's going to be like Tulsa, Oklahoma City, Stillwater, and one other place, just because those are kind of our big go-to points in Oklahoma. But that's a really good thing. So just having those mobile testing sites will be wonderful. Hopefully they're working on, making it to where the results of the test come back in less than 5 to 7 days. I know a lot of states are being able to get the results a lot faster than Oklahoma for some reason, which hopefully, ideally, we're working on. Right now it does take multiple days to get the results for your tests, and they're hoping to change that this week. We're hoping. So, he also signed an executive order yesterday. It involved 3 different pieces. So the first piece of this is that OU and OSU research labs, they're going to be able to do testing as well, which is going to help with immensely. I think I heard him say OU could do 2,000 tests at a time, and that's just absolutely wonderful, obviously. So that will help a lot too. And then also just he worded it interesting, but nurses have to renew their license every 2 years, and so he's been trying to remove any difficulties or time lapse as far as trying to get that done to expedite, their ability to just stay on the job and to not have to worry about any time in between their license being renewed, which is good. That's another good thing. And then putting medical limits and restrictions on certain prescriptions. I guess there's studies, or there's known to be a couple medicines that are for other chronic illnesses that have been reported to help with symptoms of COVID-19. And he put a limit on this just because, he doesn't want people hoarding the medicine and increasing the demand to where the suppliers can't get the actual supplies for those medicines and prescriptions to the people with the chronic diseases who need them the most. So totally get that. Again, I respect that 100%. I'm glad that's something that we've thought of and that we're doing because, obviously there's millions and millions and millions of people who also have health conditions chronically and dangerously, in addition to and besides COVID-19. So we can't forget that. And then another thing, so I was happy, like I said, I was really happy to hear from Kevin Stitt today. I know that's been something that's been really bothering me lately, is that he hasn't been present, but I was very happy today to see that. And then, so just a couple more things I wanted to touch on is statistically, I've heard a lot of people say It's just a little worse than the flu, or it's just not as bad as the flu. Like, this many people die last year or every year on average from the flu, and, COVID-19 has only killed so many people. Okay, so studies are saying, and granted, COVID-19 is new. Statistics on this are new. They're fluctuating, yes. It's a very fluid situation, but as far as the death rate for the flu, it averages at 0.1%. Okay, so 0.1% of people that get the flu pass away statistically. And then as far as COVID-19, it's around 3 to 4%. Average person with the flu, they are going to infect on average one person. COVID-19, it averages, if you have COVID-19, you will infect on average 2 to 2.5 people. So about twice as much. And then so far, as the numbers on the worldometers.int statistics website, so there's two ways a case for COVID-19 can be closed. It can be they recovered, which obviously is ideal, or they pass away. So of all the cases that have been reported and closed, the closure rate is 87 right now. 87% of all of the closures have been from people who have recovered, 87%. And 13% is, unfortunately, deaths. That's a very high number. If you think about 13% of the people who test positive and their case is closed, 13% of all the people so far that have gotten it and the closed case, 13% have died. So when you look at the grand scheme of things and think about there being, 7 to 8 billion people in the world, that's a very scary thought. That's something that I'm definitely scared about, and I'm really hoping that we're able to get this under control. I did feel kind of a shift today as far as the way people act. I think people are starting to understand, and I think they're starting to listen, and which is wonderful. It's wonderful, and I'm so happy to see it and to just kind of feel that shift go on, and I hope it continues. I guess the government, the COVID-19 task force that involves Trump and Dr. Fauci and all of those people, I guess they said that they had requested we quarantine ourselves, like a self-quarantine type situation, or we just limit our contact with people and going places and doing things, was 7 days ago. And they I guess, initiated this for what intended to be 15 days. So I believe there's 8 days left now. I didn't realize that. I didn't realize that. I thought they just recommended it in general. I didn't know it was a 15-day measure. So right now, that means that the government is looking at the next 8 days to see how we as a country react to what they've asked of us. If we can pull together as a country and do what the government asks of us, and our numbers start getting better, going down, that's really good. That means that we can prevent them from having to go another step further, which would be basically enforcing rules on us and a different lifestyle than we're used to. Because they weren't able to trust that we were going to do what they asked. So this is a crucial time, the next 8 days. They are watching, they are listening and paying close attention to how America handles this. So far, they have said, they've given us praise. They said they've noticed as, restaurants, amusement parks and theaters and just all these places are not only finding innovative ways to kind of work around this, which has been amazing actually. But everyone just seems to kind of be starting to get it, and it's clicking, and which is great. So, which leads me to my next thing. I saw Grubhub yesterday posted something about free deliveries all day to support local businesses. I thought that was so beautiful and wonderful, and I definitely agree. Like, I know we need to be saving our money right now, but comfort food's a thing. And, you know, sometimes it's just nice to have a meal while also supporting the locals, because we need them and they need us. And so, you know, if you guys want to eat out as a family or just yourself and just, you know, take out for one or delivery, I'd say that's something to definitely consider. It's very important to our local economy, especially small businesses. So, yeah, so support the restaurants, get takeout, get delivery, and then also get your groceries, fill your freezer up, you know, and I've never been one to do this. I know the snowstorms come. I know crazy stuff happens and people stock up. I'm not one of those people, but in this situation, like, I definitely believe that it's necessary to be as prepared as possible. I find peace in being able to control what I can control. And I can control my environment at home, and I can control my ability to have food and cleaning supplies and to try to limit my contact with others. And so I'm doing everything I can right now just to be aware of that. And then, yeah. So anyway, I know it's another long check-in. I seem to have more to say than I think in the beginning, but anyways, I hope you guys have a fantastic Sunday. All the good vibes to everyone out there. We've got this. We've got this, and we need to keep telling ourselves that. So anyway, have a good night.